Okay, welcome everyone to my YouTube channel. Today we will see the mock exams for medical lab students for preparation to your exit exam. So ዛሬ የምናየው እንደ ሞክ የሚያገለግሏችሁ የሚያዘጋጇችሁን ጥያቄዎች አብረን እንሰራለን ከየሴክሽኑ ማለት ነው። So don't forget to follow until the end of this video, and if you are new to the channel, please start with subscribe and like, and also share to your friends. So we will begin with the molecular biology section. Okay, so it says molecular biologist who is working at regional lab is running PCR machine for diagnosis of infectious diseases and want to monitor PCR while PCR is still running. Which type of PCR can satisfy the need of this molecular biologist? As you know, there are different types of PCR. The first is real time. So in real time PCR, the reading and the amplification will go at the same time. Okay, so real time PCR means we read the results. Okay, at the same time we read the result. There is amplification. Okay, so there is a concurrent output of the results while the amplification is already going on. Another is the nested PCR. Nested PCR, it uses two primers for specificity. Okay, the first primer used for larger sections of DNA, then the second primer is used for smaller and more specific section of DNA. So it's planned for specificities. So we use two primers. The other is reverse transcriptase. It converts the RNA to DNA. So the other is the multiplex. Okay, so on multiplex PCR uses several primers. Okay, several primers. Among these, the correct answer will be what? C, because what? It is reading. Okay, the lab technologist is reading the result. At the same time, the amplification is going on. So the correct answer will be C, real-time PCR. The another is molecular biologist was running PCR involved use of several pairs of primers to amplify more than one DNA in the same reaction to diagnose enteric pathogens. Which type of PCR? As you have said before, if we are using more than two primers for the diagnosis or for the amplification, it's called what? Multiplex. Because nested uses only two, or reverse transcriptase uses only one, which is the enzyme that converts the RNA into DNA. Okay, which is some odd or some special kind of enzyme which is contained by the retroviruses such as HIV. So the correct answer for this will be B, multiplex PCR, because we are using several primers. Okay, the next is 29 years old sexual active male patient present to facility for HIV. So he told that he has unprotected sex, multiple sexual partners, and so the doctor has ordered the initial screening using ELISA. So it has been positive for for HIV antibodies. So the physician orders confirmatory test. So in this case, we need the confirmatory test for for diagnosis of HIV. Which one is the confirmatory test? As you know, Western blotting is the most recommended confirmatory test to verify an initial positive HIV screening test. So the antibodies screened, so the result has been positive. So for verification of the positive initial, it's not the final diagnosis. You need to know for initial positive reaction, the Western blot will be will be utilized for confirmatory test. So the correct answer will be B, Western blotting is the correct answer. Okay, so the next is molecular biologist who is working in diagnosis molecular lab was planning to observe image of DNA on gel electrophoresis from the result. So, but he forgot to add ethidium bromide to DNA. What is the most probable effect of this? So we need to know the purpose of using ethidium bromide, because ethidium bromide, as you know, is used to visualize what is a dye. It's a fluorescent dye. It's used to visualize the bands. Okay, otherwise you cannot see the bands. So the major purpose of using ethidium bromide on blotting technique is on electrophoresis is to visualize, because it will bind to what the bands, the DNA or the nucleic acid bands, and it will visualize, because what, it's a fluorescent. It will release a fluorescent light. So if there is no ethidium bromide in our analysis, okay, we cannot see the bands. So the correct answer A will be A, that ethidium bromide absence will cause that no bands will be visible. So the correct answer is A. The other one is, after performance of DNA electrophoresis on specimen, the isolated DNA bands appear too close. Which of the following can be done with the next run to improve the separation of bands in the samples? Okay, so on electrophoresis, if the bands are too close, means what? It's running very fast. Okay, the analysis or the electrophoresis is, or they are migrating very fast or close to each other. So we need to what? We need to form a gap. So we need to form a gap means we need to increase the time. Okay, we need to increase the time that the analysis is running, the assay is running. So the correct answer will be B. For avoiding the mixing of bands, we need to increase the time of analysis. So the correct answer will be B. The other thing is plasma pheresis was done for transferring plasma for patients having what? Plasma deficiency, and the lab personnel received 80 units of different plasma sample. So the application of sandwich ELISA is associated with the blood bank. It is decided to use what? Sandwich ELISA as per its principle for better screening of FK. What is the basic principle behind sandwich ELISA? It says, okay, so first we need to know. So the first is direct ELISA. In direct ELISA, the antigen directly immobilized on the plate and what? Detected by single enzyme, that's what? Conjugated. We use what? The antigen already fixed to the plate or in the sample. Then what? We use the only one single conjugated antibody, indirect ELISA. The other is indirect. On indirect ELISA, we detect what? Antibody, right? So it uses what? Unconjugated primary antibody and what? Labeled secondary antibody. Okay, so we use two antibodies on indirect ELISA for detection of the antibody. Indirect ELISA ላይ detect የምናደርገው antibody ነው። Okay, so in another way, sandwich ELISA use what? Most common, and the antigen will be what? Immobilized and what? Sandwiched between two primary antibodies, the capture and what? The detection antibody. The first antibody, the primer, will capture. The next, the conjugated antibody, what? Used as indicator on sandwich ELISA. Okay, so on sandwich ELISA we use two, and which is highly sensitive, because what? We use double antibody on sandwich. So this will elevate, or it will increase its sensitivity and the specificity. So it detects antibody and antigen complex of infectious disease regardless of specificity. The correct answer, the answer is D. It's very high sensitive. So the next section will be the medical bacteriology section. Let's continue. It says, the first medical bacteriology question says, 40-year-old woman who had rheumatic fever, rheumatic heart valve was replaced with a prosthetic valve, and the blood culture became positive after 3 days of incubation, and obtrusion resistant catheter is negative, gram positive cocci was alpha hemolytic, was not isolated. So what is the most likely causal agent? So as we know, there are different kind of biochemical tests for gram positive bacteria. The first is what? Catalyst, right? Catalyst negative means it's what? Streptococcus. It's not staph. The second thing, it was alpha hemolytic. Okay, it's not beta hemolytic. So it cannot be Pseudomonas. It cannot be Staphylococcus. So the next will be Streptococcus pneumonia or Streptococcus viridans. So let us see the another thing. But what? It's obtrusion resistant. As we know, Streptococcus pneumonia is obtrusion susceptible. Okay, can be inhibited by obtrusion. So the correct answer will be what? Streptococcus viridans. because what is the first thing? Catalase negative, okay, alpha hemolytic and optochin resistant. Okay, so this is very common question on microbiology or bacteriology exit exam. So try to prepare yourself. Okay, the type of tests that are used to identify the staph and the strep, and also among the staph species and also among the strep species. These are very common. So the correct answer is C, strep viridans. The next is 30-year-old woman patient who had 5 centimeter ulcer on her leg is surrounded by red, warm and tender area of inflammation. And we did a gram stain and from the ulcer, and we saw the gram stain coxine chains culture post growth small what beta hemolytic that are catalase negative and inhibited by bacitracin. This result indicates the organic lesion is most likely. As we know that the first thing here we run the catalase. It's catalase negative, which is from strep, not staph. Next, it's beta hemolytic. So under beta hemolytic, we see what Streptococcus agalactia and Streptococcus pyogenes, because Streptococcus pneumoniae is alpha hemolytic. So from Strep agalactia and Strep pyogenes, which is inhibited by bacitracin, is what Streptococcus pyogenes, because Strep agalactia is what resistant to bacitracin. So the correct answer will be D, Strep pyogenes. This is also another question regarding the biochemical tests for identifying the gram-positive bacteria. Okay, so the next question will be: our patient is 2-week-old infant, was well until 2 days ago, and she stopped feeding and became irritable. Now febrile, developed petechial rash, and also very difficult to arouse. So her blood culture and the spinal tap were done. So the gram stain of fluid showed gram-positive cocci, what in chains. And culture of spinal fluid on blood revealed beta hemolytic colonies that grew in the presence of bacitracin and hydrolyzed hippurate. Which one of the following is the most likely? So here the finding is what? The bacteria has been found to be what? Beta hemolytic. Beta hemolytic. So it will be either strep agalactia or strep pyogenes. Next, what? There is bacitracin resistance, because it has already grown in the presence of bacitracin and hydrolyzed hippurate. So the resistance to bacitracin hydrolyzing hippurate is what? The characteristics of Streptococcus agalactia. So the answer will be B, Streptococcus agalactia. Okay. Another is a patient is 30-year-old man with 2 centimeter lesion on his arm, and it began as painless papule that enlarged, and within a few days ulcerated and formed a black crust. Oscar, he works in a battle where his job is removing the hide from what? The cattle. And the gram stain flew from the region reveals large gram positive rolls. Which one of the following bacteria like to be the cause? So here we see what? From its exposure, from his exposure, we can see that he is working what? With cattle. The first thing. Next thing, the gram stain indicates what? Large gram positive rods, gram positive bacilli. So among these, maybe Clostridium or Bacillus can be the causative agent. But here we see what? He was working with cattle. So as you know, Bacillus anthracis is usually we the infection comes from contact with the cattle, because this bacteria usually resides or lives in the fur, okay, in the hair of the animals, in the hair of cattle. So the most likely bacteria will be what? Bacillus anthracis. Okay, A is the correct answer. The next is 50-year-old insurance salesman came to gastrointestinal clinic with sore stomach for several months, and antacid relieves the symptoms after taking complete history and doing physical examination. We have discussed the case with our resident, and the resident suggested us to do what? Urea brace test. We test for the presence of urease. Which one of the following is does the resident take? So for which kind of infection is urea brace test indicated? Okay, we should know that. We should know that. So the urea breast test is what? Indicated for what? For the diagnosis or the screening of what? Helicobacter pylori, because this bacteria produce urease enzyme, which breaks down what? The swallowed urea. So we make the person to swallow urea first, then into labeled, which is absorbed and then exhaled. That means the urea that we give to this person will be what? It has carbon dioxide that is labeled. So okay, so we will as additionally next to that we'll measure his his breath. So if there is a labeled carbon in his breath or in the carbon dioxide that the person breathes out, we discuss or we can conclude that there is what? Urease producing bacteria, which is Helicobacter pylori. Okay, so the suspected bacteria is A. Helicobacter pylori, so the correct answer is A. The next is 6-year-old boy with complaint of ear hurts come to hospital. So it has been done physical exam. So this perforated eardrum, exuding small amount of pus using swab, we obtained sample of pus and we did a gram stain and culture. Okay, then the gram stain revealed small cocobacillary roots, and there is no growth on blood agar, but chocolate agar plate supplemented with X and V factor close small grow colonies. So which one of the following bacteria is most likely cause of this otitis media? Okay, so here we see the growth characteristics. The first thing, is not growing. Okay, he's not growing on blood agar plate, but he's growing on chocolate agar supplemented with X and V factor. So this X and V factor are the hemine and the NAD or the nicotinamide dinucleotide. Okay, so this kind of bacteria is Haemophilus influenza because it's fastidiously gram-positive coccobacillus. This is the first gram reaction in that shape, and what? Facultative anaerobic, and requires 2 erythrocyte factors for growth. It's very fastidious, and is NAD and hemine. NAD and these are the coenzymes. The coenzymes that are needed by for Haemophilus influenza to grow. Okay, the first thing it needs was chocolate agar. Okay, the agar that needs that has what? Lysed blood, right? The difference between chocolate agar and the blood agar plate is what? Chocolate agar has what? Lysed blood. Lysed blood means the bacteria have the chance to get what? Intracellular nutrients that are the nutrients that are found in the cells. But in contrast to that, on the blood agar plate, the cells are not light, so the bacteria has no chance to get the nutrients from intracellular, okay, from the inside cell of the red blood cells. This is the difference. So the correct answer would be B. Haemophilus influenza is the correct answer. Okay. The next is patient injured herself at home in the garden, and after several days, she developed skin lesion, infected and intensely painful, and she sought medical help. So the one group gram-positive cocci that were beta hemolytic on blood agar. On nitrogen agar, the organism produced effervescence when hydrogen peroxide was added to the colonics. Air bubble formation was observed. What is the enzyme responsible? As we know, the enzyme that will break down the hydrogen peroxide into water and carbon dioxide is called what? Catalase, right? Catalase. The first type of the first test to identify the species of gram-positive bacteria. Okay, so the correct answer will be A. This is a straightforward question. Catalase is the correct answer that will cause bubble when reacting with what? Hydrogen peroxide. The correct answer is A. Catalase. Another question, it says 18-month-old male present with fever, lethargy, malaise, productive cough, and vomit. Okay, and the culture showed Staphylococcus aureus on blood agar reveals the presence of satellite colonies. Satellite colonies, and the serology indicated organism what? Polyribitol phosphate positive, and gram stain indicate presence of gram negative coccobacillus. Which of the following? So we have to identify. We have to add the features, the serological features, the gram reaction features, and also the culture media growth features. When we mix these, satellite colony is usually produced by Haemophilus influenza when we culture the bacteria with Staph aureus. It means the Staph aureus will have a straight colony, as you can see from the image, and the growth of the Haemophilus influenza will be as a satellite, as you can see from the image. They will surround the growth, okay, the growth of Staph aureus. The colony of Staph aureus will be straight and stable and continuous, but that of the colony growth of the Haemophilus influenza B will be what? Satellite or surrounding the colony of Staph aureus. So the correct answer will be D, which is Haemophilus influenza type B. The next question says, 3 years old boy developed blood diarrhea after eating poorly cooked hamburger, and he was hospitalized with oliguria and hypertension. Which organism is the most likely infected? As you can see, we see what? Bloody diarrhea. Bloody diarrhea. So the bloody diarrhea will be caused either by intrainvasive Escherichia coli or enterohemorrhagic. But next, he was hospitalized with oliguria and hypertension. So this cause, when we link these scenarios, okay, we can conclude that the person is experiencing severe bleeding. In interinvasive Escherichia coli infection, there is some bloody diarrhea actually, but it's not that much because it's not hemorrhagic. But in case of enterohemorrhagic Escherichia coli, there is what? Heavy bleeding. So this heavy bleeding will lead to another complications such as renal damage, which causes what? Liguria, and also the disturbance of the blood pressure, which causes hypertension. Okay, so the correct answer will be the enterohemorrhagic Escherichia coli is the most common, the most probable cause of this infection. Okay. Another thing is throat culture was taken from 5-year-old boy with covering his oropharynx, and catalytic positive organism was isolated cysteine tolerate medium and subculture to thin stain medium, where it grew at black colonies with what? Brown halos. Okay, the gram stain was performed on this colony, which of the following cellular morphology was most likely seen. So we can clearly see that the gross characteristics is black colonies with brown halos. Okay, this is clearly the most known gross characteristics of gram-positive bacilli in irregular club-like shape. Okay, irregular club-like shape. Okay, so this will be gram-positive bacilli with irregular club-like shape, as you can see from this. Okay. Another thing is newborn infant develops respiratory distress shortly after delivery and taken to neonatal invasive care using for what observation. So the next day she becomes febrile with persistent dyspnea and coughing. Okay, and coughing. So sputum covered by the respiratory therapist revealed neutrophils and what? Gram-negative rods that grow as pink colonies of milk. The infective organism most likely belongs to which of the following? As you know, it's gram-negative, the first thing, and grows pink colonies. The most known, okay, the most commonly known bacteria that have pink growth on the maconche agar is what? Escherichia coli, E. coli. Okay, it ferments lactose. It distinctive flat pink to red colony on maconche agar. So the most common or the most probable genus of the bacteria is Escherichia. Okay, so the A is the correct answer. The next is a 3-year-old boy has surgery to correct urinary tract obstruction. So post-operatively, with urinary catheter in place, he develops urinary tract infection, and the urine culture shows lactose negative, oxidase positive, gram negative rod. Which of the following agents was most likely cause of this boy's urinary tract infection? So let us see the lactose negative, oxidase positive, and the gram negative rods. The first is Pseudomonas, Aeromonas, Vibrio, and Alkali genus species. They have the things in common. They are lactose negative, oxidase positive, and the gram negative rods. But as we see here, the person or the boy has caught this infection by what? Indwelling urinary catheter. Okay, so the most common cause of nosocomial or hospital acquired, because this infection is hospital acquired. So the most probable bacteria is Pseudomonas aeruginosa, because it's the most common bacteria in nosocomial infections or the hospital acquired infections. So the correct answer will be C. Pseudomonas aeruginosa is the most probable bacteria in this case. Okay, the next is a 50-year-old male patient with sickle cell disease is hospitalized for severe infection and is splenectomized and has suffered from other infections in past, such as fever, chills, cough, chest pain. They are the symptoms. So, bacteria from patient's sputum yield of touch-sensitive organisms with positive coaling reaction. Shows the following organism most likely cause of this patient. So, let us first see which type of bacteria are coaling positive. The first is pneumonia, Klebsiella pneumonia, Neisseria meningis, Haemophilus influenza, Bacillus anthracis, okay, E. coli, and Salmonella enterica. So among these, okay, optogen sensitive. Which one is optogen sensitive, and which one is the most common cause? Okay, in this case, the most common cause of infection in the optogen sensitive organism among this list of bacteria is Streptococcus pneumonia. Streptococcus pneumonia is the most common cause of infection and also optogen resistant among the listed bacteria. So the correct answer will be B, strep pneumonia. The other one is 30 years old male burn patient at healthcare facility has been progressively deteriorating. So he was being catheterized and developed severe pneumonia and intubated, now ventilator dependent. So it indicates is in ICU, and a gram-negative non-spermatic bacteria is isolated from his sputum, and it produces blue-green pigment on gross media and has grape-like fruity odor. Okay, which one is the most likely organism? As we see from this, is gram-negative, non-fermenting, and it has what? Blue-green pigment and what? Grape-like fruity odor. You have to identify this bacteria. It's very clear that this kind of culture or gross characteristics is what? The characteristics of Pseudomonas aeruginosa. Okay, so it has fruity odor. Okay, its colony looks like fruit. That means it smells like fruit. It doesn't mean that you need to smell it. You need to smell it. Okay, but you need to sniff it. But the most common cause of this kind of culture, the growth characteristics, characteristics of Pseudomonas aeruginosa. So the answer is A, Pseudomonas aeruginosa. So the next is 35-year-old sexual active male presents to internees with painless penile vesicle, and a physical examination reveals inguinal lymphadenopathy, infected organisms are definitively diagnosed and known to exist in distinct extracellular and intracellular forms. Which one of the following is most likely pathogen? As you know, the only bacteria that have biphasic, abnormal, or special biphasic nature is Chlamydia trachomatis. Okay, because what? It has extracellular elemental body and the intracellular reticulate body. So the most common bacteria that has biphasic characteristic or distinct extracellular and intracellular form is what? Chlamydia trachomatis. The correct answer is D. Number 22, 23-year-old man develops explosive watery diarrhea with blood, fecal leukocyte, and mucus approximately 3 days after eating chicken that was improperly cooked. Okay, and the coma-shaped organisms were found in the fecal smear along with red blood cells. So which of the following pathogen is most likely? So which one is the coma-shaped? Okay, this special characteristics of the bacteria of what? Campylobacter. Okay, because E. coli is rod, Bacillus, Vibrio cholerae is not coma-shaped, and also Staphylococcus is what? Is a cocci. Okay, it's a round or a spherical bacteria with what? With a cluster like grape. So the correct answer will be A, Campylobacter jejuni is a coma-shaped bacteria under microscope. The next question says 20 years old boy comes to healthcare facility with pain in his right ear, and he was his school swim team and spends about hours per day in pool. Okay, he's what a regular swimmer. You can understand that he's regular swimmer, and along the pain he was watery drainage coming from the ear, and when we see the vital examination, normal but appears healthy, but his left externally looks quite red and there is copious watery slightly red. So we can identify that from this. The first thing, the person has acquired the infection from swimming. Okay, the regular swimmer. The second thing, the main lesion or the main inflammation is out on outer side of the ear. Okay, not inside the ear but outside of the ear. So in outer part of the ear. So we can identify that the bacteria usually that cause middle ear infection as otitis media, they are strep pneumoniae and H influenza. But Pseudomonas aeruginosa cause what? Outer ear infection, which is commonly called swimmer's ear. Okay, so swimmer's ear is caused by Pseudomonas aeruginosa. So the correct answer will be for this, the responsible agent, the responsible bacteria for this infection is D. Pseudomonas aeruginosa. D is the correct answer. The next question says a 8-month-old male child present to hospital with episodes of repetitive cough, large gasps for air, as well as some vomiting. Okay, so his mother has been suffering from this condition for about 1 week, and the previous week he was reported to about cold-like illness with fever and sneezing, and white blood cell counts shows 65% lymphocyte and 30% neutrophil. So oxidase positive gram negative coccobacillus grown from nasopharyngeal pletroregalo charcoal agar. Which one of the following is responsible for the disease? It says, okay, it says, so as you know, the swab plated on Regan low charcoal agar is usually for Bordetella pertussis. So as we know, this bacteria is causes the whooping cough. Okay, and the more selective media for this bacteria is Regalo charcoal agar. Okay, because it's very fastidious. So the correct answer for this kind of infection is Bordetella pertussis is responsible for this kind of infection. Okay. Another thing is sexual active 24-year-old man presents to hospital with complaint that he has small ulcer that was formed on the shaft of what? His penis. So small papule was initially present that enlarged and then broke down. It formed ulcer with red margin, and the ulcer is painless swelling of the regional lymph node and not on physical examination. And the physician considers syphilis as the most likely cause. So which test should be most sensitive? So for different stages of syphilis, as we know that there are different stages of syphilis, right? For the primary stage, we usually dark field examination or PCR or the molecular nucleic acid test is very preferred. Okay, so for the secondary antibody secondary syphilis, usually VDR test or RPR can be preferred, but in this case, it has what small papules that was initially present that enlarged and broke down, forming annulus with red energy. So the ulcer is painless. This kind of symptom usually what is indicative of the primary syphilis. Okay, so during primary syphilis, the most common or the most recommended lab tests are usually the nucleic acid test, which is PCR, or the dark field examination. So among these options, the dark field examination is very preferable. So the correct answer is C, dark field examination. Okay. Another is a 30-year-old boy presents with painful erythematous lesions around his mouth, and the culture reveals gram-positive cocci in clusters, which is coagulase and catalase positive. Which of the following helps bacterium infection bind to immunoglobulin and prevent phagocytosis? Okay, as you know, the gram-positive cocci in clusters, which is catalase positive, and coagulase positive is what? Clearly what? Staph aureus, right? Staph aureus. So the protein that is used by the staph aureus to invade the immune system is what? Protein A. Protein A. Okay. So the correct answer is A. Protein A is a protein used to evade the immune system by staph aureus or staphylococcus aureus. The correct answer is A. Number 27 says 20-year-old sexual active female presents to emergency room with complaint of burning urination, urgency, and frequency. So the culture show catalyst positive, gram positive cocci, which is the apparent features of organism responsible for this patient's symptoms. Okay, so she has what? Burning urination. Okay, burning urination, which is what? Indicative of what? Indicative of UTI. So among the staph species, here we see catalase positive, gram positive cocci. They are what? From staphylococcus species. Among the staphylococcus species, the most common cause of UTI is what? Staph saprophyticus. And this staph saprophyticus is coagulase negative, DNA is negative, mannitol not fermenter, but novobiosine resistant. Okay, it's resistant to the antibiotic. So the correct answer is the bacteria is Staphylococcus saprophyticus, and its feature is what? Novobiosine resistant. Novobiosine resistant. So the correct answer is D. Novobiosine resistant. Okay, novobiosine resistant. Okay, number 28 it says was the name of project performed under sterile conditions to eliminate contamination to obtain pure culture. So in this case, we say the sterilization, the disinfectant, aseptic, pathogen. It's usually called what? Aseptic technique, right? It's very famous. It's very well known. Aseptic technique is what? A technique to avoid contamination of the culture media and also the contamination of the person, protection of the patient, and the protection of ourselves. Okay, it's aseptic technique is the correct term for this expression. Number 29 says 37-old man presented to hospital with 2-day history of low-grade fever, cramp, diarrhea, and 1 day prior to onset of symptoms. The 5 family members eaten all you can eat fried chicken buffet, and the fecal smear showed abundant fecal leukocyte, which shows the following laboratory properties consistent with the most likely cause of this man's condition. So in this case, we expect what kind of bacteria we should understand. In this case, the examination has revealed that fecal smear from patients revealed what? Fecal leukocyte. Fecal leukocyte means there is what? Enteric infection. Infection of the gastrointestinal tract. So the most common cause of gastrointestinal tract is what? Salmonella, Shigella, Proteus, and Yersinia. These are the most common enterobacteria. But still, we need to identify by using culture media and by biochemical tests. But the most common causes, if you are asked, these are the most common causes. So these are what? Non-lactose fermenters. These 4 bacteria are non-lactose fermenter and what? Gram-negative roots. The most common enterobacteria which cause infections they are non-lactose fermenting and gram-positive bacilli or gram-negative bacilli or gram-negative roots. So the most common likely bacteria is non-lactose fermenting gram-negative bacteria or gram-negative roots. So this is the correct answer. The next says which culture media is used to isolate staph aureus from specimens that have mixed bacteria and flora such as feces. So as you know that the most common culture media for identifying Staphylococcus aureus is mannitol salt agar. Okay, because it has what? Salt. So it will inhibit, the high salt will inhibit growth of most target bacteria, non-target bacteria, different bacteria such as E. coli. And also this has what? pH indicator, which allows to visualize and differentiate Staph aureus from other organisms. So the most common used culture media for identifying Staph aureus from mixed culture is the mannitol salt agar, due to its content of what? High content of salt, which is harsh or which is inhibitory to another organisms, another bacteria, and it allows for the growth of Staph aureus and to the interest. So the A is the correct answer. Okay, so this is all about bacteriology section. So the next section that we see is the laboratory quality assurance. Okay, the laboratory quality assurance. So let us begin. So the first question from lab quality assurance question says acceptable range for hemoglobin control sample is what? 30 plus or minus 0.5 gram per day. So the determination is performed 5 times in succession on the same control. The results obtained are 12, 12.3, 12, 12.2 and 12. Which of the following the best description? So let us look at the results. Okay, when we look at the results, they are what? Close to each other, right? They are consistently close to each other. They are usually 0.1 or more difference. They are consistent, but what? They are not what? They are not correct because the expected result is what? 30 plus or minus 0.5. It means 12.5 or up to 30.5. Okay, 12.95 up to 30.5 or 12.5 up to 30.5. But the results we obtained are, they are around this, but they are close to each other, but not close to the accurate result. They are not accurate, not close to what? The correct result. The correct result we get from what? From the control sample. Okay, so they are not accurate, but they are close to each other. Means they are precise, but not accurate. So the correct answer is A, precise, not accurate. Number 32 says, recent graduate lab technician needs to apply for vacancy announcement as a junior lab technologist. This is also the path for most of you, okay? And he tried to apply with curriculum vitae, temporary degree, and that student copy. The human resource asks for another document. What is the most probable? As we know that after you graduate to apply for a job, what you need is the CV, okay? The curriculum vitae, the clear description of your quality, your background, educational background, birthplace, and a different background about yourself. Additionally, your student copy is important, and also the temporary degree. Or if you have learned sponsor it yourself, you may obtain the original copy from the university or the private college that you have learned. But additionally, as a health professional, to practice in the country health system, you need what? License, right? The professional license. Okay. After exit exam, you will take after your graduation, you take the licensure examination. Okay, as a health professional. For every health professionals, they take what? Licensure examination. So once you have passed that exam, you'll get license from the Ministry of Health, right? So to practice, you need what? License. Okay, license. Okay, license. Because certification is not mandatory. Licensure accreditation is given for institutions, not for individuals. Proficiency result is also not individual. So the correct answer is B. You need licensure. Okay, licensure. So there is a COC exam or licensure exam, as you know, after your graduation to get a license. So another question will be newly prepared acid-fast staining reagents, carbofusion and methylene blue, have been distributed by regional lab to different laboratories. And each facility that received reagents is told to check final quality before apply to patient examination. What's the most probable method for checking the quality of reagents in each facility? So the reagent has been distributed by the regional lab to district labs or to the health institutions that are below that level. So here we need to verify that the reagent is the reagent is qualified. So we need to expect first. We need to identify its expire date. Okay, its quality. So the most common approach to identify or to assess the quality is using what? Control samples. we can use what? The blank samples, usually control samples. Control sample is what? The sample that is what? With known concentration that is expressed with what? Within the normal reference range. So if you are trying to identify, or if you are trying to evaluate the quality of different reagents that are distributed to different institutions, it's better to use control samples. For every, especially the regional labs, they distribute the reagents. Additionally, they distribute what? The control samples. Because in each lab, it must be tested against the control samples for quality. So the correct answer is B. It should be performed using appropriate control samples. So the B is the correct answer. The next is hematology section. We need to go to the hematology section, another section, important section in medical lab technology. Okay, in medical lab technology. So let us go to the next. So it says 50-year-old man presents to hospital with complex unwellness and easy fatigue, and there is a routine test which demonstrates white blood cell count of what? 85,000 per ml, which is very high, and also molecular diagnosis reveals that there's chronic myelogenous leukemia. Okay, and chromosomal translocation is responsible for this disease. Which of the following translocation is associated with this disorder? Okay, so when we see the molecular background of the leukemias, there are translocations, frame shift mutations usually. Okay, the main cause of cancer, or the main cause of blood cancer or leukemia, is usually the translocations in the genes that code for the what? For the development of the cells in the bone marrow. So the most common type of molecular disorder is T922 translocation. Okay, it's reciprocal translocation when parts of chromosome 9 and chromosome 22 swap places and associated with CML. Okay, translocation means what? Exchange of the nucleotide. Okay, exchange of the nucleotide. So swap means interchange of places. Okay, if there is interchange of places on the chromosomes, there will be what? A chance of what? Irregularity in the control of proliferation of cells. This will lead to disorders such as leukemia, of which chronic myelogenous leukemia is one. So the most common type of translocation is T922. Okay, the translocation between chromosome 9 and the chromosome 22. So the correct answer is D. The next says 32-year-old woman diagnosed with chronic lymphocytic leukemia, and she developed lymphadenopathy and splenomegaly upon follow-up. And each of the following is most likely present. So as you know, in chronic lymphocytic leukemia, there are some distinctive features. There are special or very common features. Which one is the most common feature in the bone marrow, in the peripheral smear of chronic lymphocytic leukemia? It's what? The presence of smudge cells. The presence of smudge cells is the most frequent and common finding on the blood smear result of the patients with the chronic lymphocytic leukemia. So the correct answer is D. Okay. Number 36, it says the patient came to hematology department with the request paper for a blood cell count, and the routine test performed in the lab was manual cell counting using what? Improved neighbor chamber. The lab technologist wants to select the element used for RBC, which is the most appropriate diluent. As you know, the most appropriate diluent in manual count of for RBC is what? The formal citrate. Okay, the formal citrate, because what? It prevents coagulation, the first thing, and also what? It preserves the cell morphology by fixing the cells. So it has acts what? As a anticoagulant, and also what? Acts as a preservative, and also it prevents lysis because what? It's isotonic. So the formal citrate is very recommended for the manual counting procedure of the red blood cells. So the correct answer is B. So the other is 50-year-old young patient present with features of anemia, neutropenia, and thrombocytopenia. A large number of blasts present of bone marrow biopsy, which investigation would help to differentiate between acute myeloid leukemia and what? Acute lymphoblastic leukemia. Okay, so here we have what? Large number of what? Large number of blasts. If large number of blasts are present in the peripheral blood smear, we expect what? The acute type of leukemia, not the chronic. Because usually on chronic leukemia, we expect more mature cells, not blasts. The immature blast cells are expected on acute. So on acute leukemia, and also we have to identify whether it is what? Whether it is myeloid or lymphoid. So we have to identify which kind of chemicals or enzymes are present on myeloid cells and the lymphoid cells. The most common enzyme that is present in myeloid cell is what? Myeloperoxidase. Okay. It's very distinctive for myeloid cells. It's not present in lymphoid cells or lymphoid blasts. So the correct answer will be A. Myeloperoxidase stain is important. This stain will stain what? The myeloperoxidase enzyme in the blasts. So it will differentiate. Okay, if we found that there are stained cells, we can identify that it's what? Myeloid. If there is no stain after using, we can conclude that it's what? Lymphoid. So the correct answer is A. Myeloperoxidase stain is the best stain to identify its myeloid or lymphoid kind of leukemia. So the next question says 27-year-old woman patient complains of thyroid tiredness during activity. So she appears pale and also all rods and the schistocyte can be seen on peripheral smear. The patient is referred for bone marrow biopsy. Okay, bone marrow biopsy. Don't forget that there is what? All rods and the schistocyte. And extracted cells that are for cytogenetic analysis, and cytogenetic analysis revealed chromosome translocation T1570 between the chromosome, the 15 chromosomes and the 17th chromosome, which of the following most likely. So we see all rods and the schistocyte. It's what? It's from the myeloid series, not lymphoid. The next is on the cytogenetic analysis, we see the translocation between the 15th chromosome and the 17th chromosome. It will identify what? Acute promyelocytic anemia. Okay, because on other kind, this is on the cytogenetic analysis, the most specific test for what? Identifying among the myeloid cells. Additionally, the orals and the schistocytes are present in the myeloid series, in myeloid blasts, not on the lymphoid. Okay, so D cannot be answered, and also Burkitt's lymphoma cannot be answered, and also mantle cell lymphoma cannot be answered, because lymphomas are the malignancies in the lymphoid series, not the myeloid series. But all roles are the distinctive features for what? Myeloid cells. So the correct answer will be acute promyelocytic leukemia. C is the correct answer. Number 39 says patient peripheral blood film demonstrates agglutinated RBC and CBC and elevated MCHC or mere cell hemoglobin concentration. What other parameters will be affected by agglutination of the RBCs? So when there is agglutination of RBCs, what? When there will be agglutination of RBC means what? They will cramp together. So A says MCV will be decreased. No, because MCV will what? It measures the mean volume of the cells. So it does not cause the decrease in the MCV. B says MCV will be decreased and the RBC count will be decreased. Indeed, the RBC count will be decreased, but again, MCV will not be decreased. C says MCV will be increased and RBC count will be decreased. This is the correct answer, because during agglutination, 2 or 3 cells may appear as one, may be counted as one during automatic analyzer. Okay, by the automated analyzer, the agglutinated, the clumped cells may appear as one cell. which has a larger volume than a single cell. Okay, so MCV will be falsely increased and RBC count will be decreased because there is a clump, right? There is agglutination means the clump, the number of individual RBC will be low because they have already formed agglutinate or they have already formed a clump. So the correct answer will be C. The MCV will be increased and also the RBC will be decreased. So the correct answer is C. Number 40 says 40 medical lab science student consistently makes wedge technique blood films that are too long and what thin, which differs from quality of good peripheral blood film, which changes technique will improve. So if our smear or thin smear is very too long and thin, what will be the cause? Maybe our angle of spread may be what? Too low, too low or too small. So increasing the angle should be what? Should be considered. Because when the angle increase, the thickness of the RBC and the length of the RBC, the thickness will be increased and the length of the smear will decrease when we increase the angle. But when we decrease the angle, the length of the smear will increase and the thickness will be decreased. So the correct answer should be what? To increase the thickness, we should increase the angle. Okay, we should increase the angle. So the correct answer is D. Increasing the angle will be the solution for this problem. Another is which of the following is term for erythrocytes resembling stack of coins or intense secretion of peripheral blood. So stack of coins means a roll of. Okay, it's very easy. The red blood cell will appear as a stack of coins. Okay, stack of coins. So the correct answer is D. Roll formation. Number 42, which is another question from the hematology section, says coagulation of fresh blood is prevented through the use of anticoagulant, the structural fluids that can be separated from the cellular elements now. So here what? The whole blood, the coagulation has been what? Prevented, right? It has been prevented. But if there is coagulation, the fluids that we get will be what? Serum, right? Will be serum. But in this case, we have prevented what? The coagulation. Prevented. There is no coagulation. So after the supernatant will appear on the top and the RBCs and the white blood cell will what? Will be deposited, will be sediment at the bottom. So if there is no coagulation, the supernatant that will get will be plasma. But if there is coagulation, the supernatant that will get will be what? Serum. But in this case, there is no agglutination. Agglutination has been prevented, so the supernatant that will get is what? The plasma. B is the correct answer. This is a very common question. You need to work towards that. Another question is blood sample is drawn up to 0.5 mark in RBC, tomopipette, and the other part is filled with formal citrate. The dilution ratio used for RBC is what? 1 to 200, and 210 cells are counted in the 5 small squares. So the center square is unproved. Never change. What is the RBC count? So as you know from the calculation formula, to calculate the number of cells counted, we multiply what? The number of cells that are counted times what? The dilution factor over the area counted. Accordingly, we multiply 210 times what? The dilution factor, which is 200. And what? We divide by the area counted. Okay, so when we divide it, we'll get 2.1 times 10 to the power of what? 3 per ml. Per millimeter cube is milliliter. So when we divide, when we change to liter, we need to multiply it by what? 10 to the power of 6, which will be 2.1 times 10 to the power of 12 per liter. These are the number of cells that are counted when you calculate against the liter. So the correct answer is A. Number 44 says 44-year-old man presents to emergency room with 2-week history of diarrhea that has worsened progressively over the last several days and has minimal urine output and admitted to hospital to get dehydrated. His stool specimen is positive for parasitic eggs. which type of leukocyte cell will be elevated in number. So during parasitic infection, which one will be elevated? Eosinophils will be elevated. They are the most common white blood cell types that are elevated during what? During parasitic infection and during allergy. Okay, during allergy such as anaphylactic reactions, parasitic infections, eosinophils are the most common type of WBCs that are elevated. So the correct answer is A. Okay, the other question is 3-year-old boy bleeds excessively from minor injuries and previously had bleeding gums and maternal grandfather has bleeding disorder. So his physical exam shows slight tenderness of knee with fluid accumulation in the knee joint. So we suspect this patient is deficient in which coagulation factor? So the most common bleeding disorders are hemophilia A and hemophilia A, B. So they are caused by the factor 8 deficiency and the factor 7 deficiency. These bleeding disorders because they have been not inherited. As you can see, the maternal grandfather has bleeding disorders. They are inherited bleeding disorders, hemophilia A and B. So they are caused by factor 7 and factor 8 deficiency. Among these options, factor 8 deficiency is the most common cause of this kind of inherited bleeding disorder. So C is the correct answer. Factor 8 is a deficient factor. Number 46 says patient has fallen lab results. RBC is 2 times 10 to the power of 6. Hematocrit 24%, hemoglobin 6.8, and reticulocyte 0.8. What is the mean cross-sectional volume? MCV. As you know, MCV is calculated by MCV means what is the mean cell volume, the volume of the cell. It will be calculated by what? Hematocrit over what? Number of RBC expressed per what? 10 to the power of 6. Okay, so we directly divide 24, okay, 24 over what? Over 2. We take 2 from RBC, 24 what? From hematocrit times what? Times 100, right? Times 100. So it will be 120 femtoliter. C is the correct answer. Okay, C is the correct answer. Number 47 says lab technologies collect the blood sample by DTA from 35-year-old man who encountered car accident today morning. He performed CBC and result indicated decreased cell count, but what? Normal hematocrit value. What is the most likely type of anemia the patient has developed? In this case, the hematocrit value is what? Normal, but red cell count is what? Decreased. So in this case, hematocrit value is normal, means hematocrit means, as you know, the ratio of the RBC to what? The ratio of the RBC plus the plasma. So in this case, the plasma is normal or increased, but the decreased, the red cell is what? Very low. Very low. So in this case, we expect a normocytic normochromic anemia due to bleeding. Usually, if there is a bleeding, we expect normocytic normochromic anemia. Okay, because in this case, if there is a sudden bleeding, our body will replace plasma very fast, but the production of RBC will lag behind. So in this case, the plasma concentration will be higher, but the RBC will be lower. In this case, the hematocrit will not be changed because there is what? Increased plasma level. So the correct answer is A, normocytic normochromic anemia. Number 48 says a routine CBC count from 6-year-old boy shows 70% blasting peripheral calculation and cytochemical time with myeloperoxidase and Sudan black B was negative. Based on these findings, from what condition is the boy most likely suffering? So here we see what? Myeloperoxidase and Sudan black B was that? Negative. In this case, myeloperoxidase is not found, Sudan black B is negative, means it's not myeloid. It's not myeloid. Okay. So and also it indicates what? 70% plus. 70% plus means what? Is what? Acute, not it's not chronic. It's acute, and that's what this kind of things indicate was there. It's not myeloid, because the myeloproteinase and the Sudan black pea, they are all found. If the case is myeloid, they are found. They are positive. Additionally, if it's chronic, we find that the number of blasts is very low. But in this case, the number of blasts is very high, which is acute, and the myeloproteinase and the Sudan black is negative. It means what? Lymphoid. So the most common cause is acute lymphoid leukemia or acute lymphocytic leukemia. So the correct answer is D. Number 49 says when performing a manual with a blood count, 236 cells were counted on side number 1 of hemocyte meter, and 224 cells on side number 2, and 1 to 20 dilution of 1% hydrochloric acid was used, and the area counted was 4 square millimeter. So we found 25 nucleated red blood cells in the differential were observed per 100 white blood cells. What is the correct WBC? So we can recall from the formula of correct WBC. So the correct WBC value will be uncorrected WBC times 100 over 100 plus number of nucleated RBC observed per 100 of WBC. So we're replacing in between. The total cells count will be 224 plus 236 will be 460, and nucleated RBC will be at 25. So by replacing the numbers in the formula, we'll find that final correct WBC per microliter will be, and we'll find 9,200 WBC correct WBC per microliter of blood. So B is the correct answer. Number 50 says, why is it's important to have scrupulously clean hemocytometer when manually counting platelets? Because if there is any debris, any artifact on the hemocytometer, it may be wrongly counted as a platelet. Okay? If there is some dot, artifacts like dot or some impurities on the hemocytometer, we may wrongly count it as a platelet. Okay, so the platelets have very small size, as you know that. So their very small size may be counted as we may mistakenly count them as a platelet. The dirt may be counted as a platelet, and there will be a false increase of the platelet number. So we have to identify. So the major regions, their small size or the small size of platelets makes them easily confused with the dirt. Okay, the dirt maybe can be counted as falsely as a platelet. So the correct answer is C. Their small size makes them easily confused with dirt. Number 51, the last question says manual WBC count was performed in the total of 72. Cells were counted in 4 large millimeter squares of neighborhood hemocytometer, and 1 to 20 dilution was used, but the calculated WBC count. So we can recall from the formula for calculating the manual WBC count. So it will be the total WBC counted times the dilution factor times 10 over number of squares or number of area counted. So we can replace the number. The total counted WBC is 72 times the dilution factor is 1 to 20. So the dilution factor will be 20 times 10 over, we have used 4 squares of the improved nerve chamber, so over 4, so it will become 3600, which will be 3.6 times 10 the power of 3 WBC are being counted per microliter. So this is all what I have for a mock exam and mock questions for your preparation to the exit exam. So I will wish you good luck. So if you are new to the channel, so try to watch another videos that have been posted on this channel about different sections of exit exam. Okay, exit exam from different years. So it has been posted previously. So try to test them. Thank you for watching until the end. So don't forget to subscribe, like, and share it to your friends. So another time we'll be come up with another video. So have a nice day.